So, good morning, Dr. Johnston. I am so happy to have you online with me today and know that we are going to provide a lot of people with some very exciting help for their knee and hip pain. So for those of you tuning in to Dr. Johnston and myself, Lynn Weems from A Different Kind of Better, we'd like to welcome you to our platform today and let you know that this is a platform that's here to help healthcare providers and wellness practitioners to be able to educate the world on things that they may be having concerns about. So today we're going to be talking about, as I said, knee and hip pain with what I call an expert on this. I've known Dr. Greg Johnston, who is, by the way, from St. Thomas, Ontario, Family Health Options, a very well-known practice in the local area who services a lot of clients. So I'm going to talk to you a little bit about Dr. Johnston's background and introduce him to you a bit. I have had the pleasure of knowing Dr. Johnston for actually from when you started, Dr. Johnston, which was about 21 years ago, and got the pleasure of working in the same facility as him for a few years. So I know him fairly well, and I know that he loves his clients and goes above and beyond. And so he has been a practicing chiropractor for 21 years. Let's give him an applause for that, because that is, a really, really good practice to have for such a long time, and it allows him to learn on a daily basis with his clients as well. He is a graduate of the Canadian Memorial Chiropractic College, where he received his doctorate of chiropractic. He has also attended the University of Windsor, Ontario, and obtained a bachelor degree in human kinetics as well, which makes him even more special in this field. He is currently a member of the St. Thomas Chamber of Commerce, which I think is a great thing to do for your community, to keep you in tune with what's going out there in your local area with the businesses and having the supports, and believes strongly in being active in the community. He is constantly pursuing education. I know that for a fact. And I find that with a lot of professionals is that once they get started, there's no stopping. It just continues for years and years and years. And so he has recently continued his education so that he can serve his patients better, which he has always done. And he completed a certification in the Good Life with Osteoarthritis program. And he's here today basically to discuss this program. So thank you, Greg. Do you have anything to add to that, or did I do an okay job with your help?
You did a fantastic job. You're going to make me blush with all the accolades. I appreciate very, very much. But yeah, it's a pleasure to be with you today, Lynn. Thank you very, very much. And yes, it's hard to believe it's been 21 years since I've been in practice here in St. Thomas, and enjoy it thoroughly, and very proud of our clinic at Family Health Options and what it does for our community, for sure. Thank you. Excited to talk with you today about this topic as well.
Wow, that's great. So there's going to be a lot of people joining us today that are suffering with knee and hip pain, and I have been mentioning it on my Facebook page. So I'm hoping that, we've targeted this area, and that a lot of these people, and they may be coming in to actually learn because they know someone else that may have this issue. And we will ask that you share this video with them if you get an opportunity, if you know somebody that is suffering that you think you may help. So by being online with us today, or taking time out to actually watch this, you may actually be able to help us help other people as well. So I guess what I'm going to do is start the interview with basically the beginning. I'm hoping that you can explain to us what the program is that you're starting and launching across Canada, and tell us a little bit about that first.
Sure. Well, the GLAD program was a program that initially started actually in Denmark. And GLAD is an acronym that stands for Good Life with Osteoarthritis, Denmark. And they had a lot of success with it in Denmark, dealing with people helping to decrease pain, increase their function, and basically increase their quality of life, dealing with knee and hip osteoarthritis specifically. It was so successful, it became very well known around the world. And so in 2017, the Canadian Orthopedic Foundation brought it to Canada and has been working at disseminating it across the country so that people can access this program, because it is really effective of helping people deal with knee and hip osteoarthritis specifically.
Yeah, so it must be really exciting to be part of something that is just about to launch, right? Right in the beginning stages.
It is. It's in the early stages. Again, they brought it in 2017, so it has been around for a couple of years for sure. But they're in the process of, and one of the things about the process is that the practitioners that deliver the program have to be certified through GLAD Canada. So there is an educational component with regard to it. So as I did earlier in June, there's a seminar series that we have to go through to actually become registered with them to be qualified to deliver this program. So that takes a little bit of time, but it is really exciting because the results that they've seen in Denmark and the preliminary results here in Canada have been really phenomenal as far as what they've seen with, again, those parameters that I talked about, with decreasing pain, increasing function, and basically increasing people's quality of life dealing with these problems with knee and hip osteoarthritis specifically.
Yes, and you know, I've worked in the medical field, you know, my background for many years, and I have to say that I am seeing a lot more knee and hip pain recently than I have in previous years. Do you think there's a reason for that, or?
Oh, absolutely. Knee and hip pain is one of the more prevalent areas for osteoarthritis to develop. And, you know, perhaps we can even go back and talk about osteoarthritis a little bit, because I think that creates a lot of confusion for people. Osteoarthritis is a very insidious type of problem. It starts slowly, and, you know, perhaps people in their 30s and 40s maybe develop occasional pain in their knee or occasional pain in their hip where it hurts them, it becomes a little bit stiff and sore, and you know that goes on for a period of time, and then perhaps when they get into their 50s and into their 60s, certainly that starts to increase and become more of a problem, and it's at that point that they start to perhaps, you know, pursue looking at what's happening with it. Part of why we're seeing an increase in it is because our population is aging. And that was one of the reasons that brought me into wanting to really pursue this and be qualified in having another tool that I could help, because I was seeing more and more patients coming into my clinic with knee pain and hip pain and wanting to deal with it specifically. And so a lot of it has to do with, again, you know, an aging population. A lot of the parameters, unfortunately, things that people get tired of hearing, have to do a lot with our lifestyle. A sedentary type of lifestyle. Certainly increased body weight has an influence on it as well. And all these types of factors specifically. And then other things like even leisure pursuits. So people have good intentions of going out and exercising, going to the gym, but perhaps they're overdoing it or doing exercises improperly, and as a result, perhaps are injuring themselves as well. And so that's part of what the GLAD program is about, is actually teaching people how to exercise properly within certain parameters so that they don't go into those types of things where they may be injuring themselves inadvertently.
Right. So as a layperson with no background and somebody who's starting to have pain in their knee or an ache in their hip, or, you know, difficulty getting from a sitting to standing position, are these some of the actual symptoms? And how would you decide how would they know the difference between, say, just a regular arthritis and an osteoarthritis?
And that's a very difficult thing to assess. And this is the interesting thing about it. Knee and hip can be a myriad of different reasons why those things may be developing. So it's difficult for the layperson to know or diagnose themselves. And that's why it would be important to go see a professional like myself, a chiropractor, physiotherapist, perhaps their medical doctor, even a massage therapist or a certified kinesiologist could help them as far as actually looking at and assessing where the problem area is, doing orthopedic testing, doing the proper history and different parameters that we would look at to decide whether, in fact, maybe this is an osteoarthritis that we're dealing with specifically. In general terms, people will find that a lot of times it's use type of pain. So when they go out and walk, or when they're doing certain activities that their knee starts to bother them or their hip starts to bother them, that's one of the hallmarks that we look at specifically. Usually the discomfort will be relieved by rest. So when they do rest it, perhaps ice it, that will sometimes help with it specifically. Morning stiffness is another thing specifically. When people wake up in the morning and they find their knee to be, extremely stiff and sore. And it's almost amazing sometimes how stiff and sore it may be first thing in the morning, but after they get up and move around for several hours, it feels like it's back to normal. And that again can be another sign that that may be indeed what they're dealing with. Sometimes the joints will make funny noises. People come in all the time into my office and say, "Doc, listen to this," and they move their knee or their hip or their neck or something, and it's, they say, "Oh, it sounds like Rice Krispies in there." So that's what we call joint crepitus, and that can be also a sign perhaps that we've got some osteoarthritis going on there specifically. From a clinical point of view, we look at range of motion, so we would do some orthopedic testing and see what kinds of problems we might be seeing or limitations we might be seeing with some range of motion and those kinds of things specifically. As well, sometimes there can be visual types of things. So a lot of times with the knee particularly, you may be seeing some bony enlargement around the knee where there's some extra bumps on the knee in certain areas that might indicate an increase in one of the types of reactions we see with osteoarthritis, which is increased bone growth actually in and around the joint. Sometimes it's referred to as an osteophyte. And you can actually visually see that. And certainly we can physically feel it and touch it when we're palpating a joint to see what's going on there specifically. And then one of the other hallmarks would be kind of an ongoing type of a pattern or a theme over several months or even years that someone is having an ongoing problem there. And that's kind of a bit of a yellow flag that perhaps, there's been some joint destruction that's been going on here for a period of time. And now it's just gotten to the point where it's bad enough that they're realizing that, oh, I need to talk to somebody about this, or I need to do something about it.
Yeah, and with the recent, lockdowns and viruses and the backups of surgical help, people
Right.
are on long waiting lists for surgery. They were on a long waiting list prior to, the recent viruses, but so now they're even longer. I think this is something that is definitely needed, right?
Oh, absolutely.
This is something that can maybe help them get through it.
Well, when we look at things like knee and hip osteoarthritis, there's kind of a triangle of types of treatment that we look at. And at the bottom of that treatment, the bottom of that triangle, everybody with osteoarthritis in their knees and hips can benefit from a really good exercise program specifically. So, and this is one of the things that's interesting about this, is that everybody with an arthritic condition can benefit from an exercise type of program. Going up the ladder, less of those people will actually require more invasive types of treatments like cortisone injections or those kinds of things, or even medications per se. Some people do need that, but less of that whole group of people will necessarily need that. And then on top of that, at the very top, which is always one of the last resorts, there are more things like surgical types of interventions. And there are a small percentage of people, unfortunately, that have to get to that point with it. But even those people that are at that point where perhaps they do need to have a surgical intervention, they will still benefit from doing an appropriate type of exercise program. Now, that program may need to be modified quite greatly in some cases, but they will definitely still benefit from that. And that's the interesting thing about this. Anybody with an arthritic problem in the knee and hip region will benefit from a program like this. So it's not something that's a specialty type of thing that's only for certain people. And again, there are modifications built into the program, even for people with very severe types of conditions. And the nice thing about that is, even if someone is looking forward to having surgery, if they go into kind of an exercise program before the surgery, prehab sometimes it's referred to as, it really can help with the outcomes after the surgery. So the better shape you're in going into the surgery, even doing some exercise beforehand, the better your chances of coming out of that surgery will be as well. And sometimes people have the attitude, well, I'm not going to bother with it because I'm going to have the surgery, it's just going to get fixed and I'll be fine, so why would I go to all that effort? But we're not machines, and the human body responds differently. And if you go into that surgery in better condition, better shape, better range of motion, with the muscles being stronger around those joints to support them, then the chance of coming out of that surgery more successful is greatly increased.
I 100% agree with that. 100%. And definitely, having seen post-surgical complications in my lifetime, a lot of the time it was more related to not being prepared for the for that procedure,
Mm-hmm.
right? So,
Sure, absolutely.
so tell us a bit, now we have the symptomatology set and what to look for and how they can benefit from the program. But tell us a bit about the program itself, the processes involved, how did they get started, that
Sure.
stuff.
Okay, sure. Well, the program is kind of a three-pronged approach, I guess, specifically. Has different components with it. We've been talking about exercise, but it is an educational and exercise component. So there's an educational component to it. So that's one of the first things that's in the program. And so that involves actually going through a couple of presentations, some educational experiences with the patients that are involved with it, to teach them about osteoarthritis, to teach them about the program, to teach them about exercise and that it is safe for them to exercise. One of the biggest things that people have with something like this is fear that they're going to damage their joints through exercise. And so teaching them that it's okay to exercise with a little bit of discomfort, and that's not really actually doing further damage, but it's actually going to help with the problem in general. And then there's the actual exercise component of it, which is a 6-week program, 2 sessions a week over 6 weeks for about an hour each session with it. So there's 12 sessions specifically with it, going through a circuit of specific exercises that are designed to help with things like balance and posture and strength and range of motion. And it has a lot of functional components involved in it specifically. So things that involve everyday types of activities. So getting up out of a chair, moving and climbing stairs, things like that specifically that are incorporated into it. The other exciting part about this is there's actually a research and an educational component to it with regard to the idea that there's actually a national database, and there's a registration component to it for the patients if they choose. They can opt to not necessarily want to be part of that registration process. And through that, what we do is we measure certain parameters. So there's a couple of field tests that we do with people to begin with to get a baseline to see what their function is. And then there's some questionnaires that GLAD Canada itself will contact them via email for them to complete as well. And this is very, very valuable information because it tells us about the profile of osteoarthritis with knees and hips across the country. It tells us about how people are responding based on this type of exercise program. And it gives us some really valuable information as to how beneficial it is, but more importantly, how we may need to modify it or change it or increase the ability for people to access it, and gives us just very, very valuable data so we can understand this, this monster of osteoarthritis that's growing within our country and learn better how to manage it. And that's an important component of this particular program as well. As far as people getting involved in it, it would be a matter of contacting our clinic, so at Family Health Options, which we'll probably have the contact information, but basically we do have a website, which is www.familyhealthoptions.ca. Our phone number is 519-637-7778, so they can contact the clinic that way with it specifically. And the first thing would be to have an assessment done to make sure that we are dealing with what it is that we think that we're dealing with specifically. And once we've diagnosed that and know that that's exactly what it is that we're dealing with, then it would be a matter that I would talk with them and give them instructions about what we would do moving forward, moving them into this program specifically.
Wow. So that actually
lots of information.
It's a lot of information, but it's actually not that complicated, right? I mean,
no, it isn't.
Basically,
no.
just to get started, just call Family Health Options. Sure. Ask for Dr. Greg Johnston's for info about his new program, specifically the GLAD program, because it will make them glad to be part of this, right? And
sure,
so I love the name they have given this project. It's really exciting. So let's talk about something else, because I like to bring this up on most of the interviews I'm doing is, a big part of wellness is affordability, sure. Right? And being able to get it out to people. So maybe you could help people there with them not thinking that this is going to cost them thousands of dollars. And yes.
Sure. Well, I mean, we, as a chiropractor, if people are familiar with chiropractic, then we are kind of a private healthcare type of modality that people can access. Now, a lot of people have extended healthcare benefits. So one of the things that we can do is actually use their extended healthcare benefits towards them participating in this program specifically. Because I am a chiropractor, basically the reflection of it is that it is the chiropractic treatment that I'm using in this particular case, rather than actually adjusting or putting hands on or things like that. Specifically with regard to what we're doing treatment-wise, we're delivering a supervised exercise program. And that is part of the scope of practice of chiropractors in general, and certainly part of the scope of the practice that I do myself specifically. So as such, it's a chiropractic treatment, and then it can be looked at as a treatment that's being delivered, and people can use their extended healthcare benefits for that specifically. So that definitely helps.
Yeah, and to be honest, I mean, I have had chiropractic treatment, and I find, you know, that it's not a very large amount coming out of your pocket at one time. You know, you pay on a visit basis, so it is definitely affordable for people.
Well, definitely, and I think, like you say, relatively speaking to other things, it definitely is an affordable thing. It's an investment in your health for sure. We also have some different types of financial packages within our clinic as well. So we try to work with people whenever possible to come up with solutions for them to make it so that that's not a barrier for them. And as chiropractors, we want to be able to help everybody, but obviously the reality is I still have to be able to feed my family. So we still have to kind of come up with a way to do that and pay the staff and do different things that way with it for sure as well. But as I say, we do have financial packages that we try to work with people to find different solutions for those types of problems for them all the time for sure.
That's really exceptional to hear that your office does that. So that makes me very happy, because so many people don't get the help that they need, and they don't realize that if they just asked for the help, that it's probably more than likely there for them, right? So another thing I think we need to cover is where do they go? I know that you have the clinic there, but are you, is this going to be virtually available to people if there's a lockdown, you know, in the future, that kind of thing?
And that's been an interesting thing as of late. There's some different, again, parameters as far as how I can deliver the program. One of the things we can do is deliver it one-on-one, which is very easy to do within the clinic specifically, and that's something that I'm willing to do with people. The program itself is actually designed to be a small exercise group type of program specifically. And again, anywhere between 4 to 6 people is probably ideal within an exercise setting. The nice thing about that component of it is it's a bit of a spin-off thing. It's not a formal part of it, but there's a supportive network with people get together in a social type of environment who are having similar types of problems and similar types of symptoms, and they can work together and support each other with it. So a part of the program that has been, like I say, not a formal but is an informal part of it is that supportive network socially within it. Of course, under our COVID restrictions, that's become a little bit more difficult to do. There's no doubt about that. So, but we are working at different ways of being able to implement that. And as well as with everyone, at the clinic specifically, we've been working on different ways to deliver healthcare through virtual means. So that is another, possibility that way with it specifically. And so that's something that, again, if people contact the clinic, we can look at the different ways that we may be able to access them, or they may be able to access us, I guess, more appropriately, so that we can deliver this program for them for sure.
Wow. Well, I'm really excited that you're getting this going, and I will definitely be making some referrals over to you. So get prepared for that.
That's great. I appreciate that.
So I think we've almost covered everything. Is there anything else you can think of that maybe may help people?
I think we've covered a lot of things, I think, for the most part. I mean, the other thing to keep in mind is that this is a national program. So people can find out more information about it at the GLAD Canada website, which is simply gladcanada.ca. On there, they'll find a listing of different practitioners. So depending on where people are living and who's accessing this particular program, if you go on that website, they will have a list of certified practitioners in their area that they can find that are delivering the GLAD Canada program as well. So I'm not the only one doing it by any means, for sure. It's very heavily weighted in Ontario, particularly in Ontario and Quebec, I believe. But there are representatives and there are practitioners doing this right across the country. So whatever province you're in, you should be able to probably access someone that way with it. And as you mentioned before, the interesting thing is being able to do things virtually. Certainly it's possible that people may be able to access from remote areas, even if they don't have someone in their immediate area. So I would certainly strongly encourage people to go to the GLAD Canada website, like I said, at gladcanada.ca. They can certainly find out more information about the program there specifically, and they can certainly access a database there of different practitioners that are delivering the program for themselves as well, too.
Awesome. So thank you so much for allowing me to interview you and for allowing people to see this program internationally, hopefully, but more
Cool.
so nationally and locally. And you're right, it's good that you mentioned the actual website so that they can, if they're not from our local area, they can certainly still get looked after. I want to thank everybody for coming and watching this this interview today. We hope that it helps a lot of people. Please pass it on to anyone that you know that may be suffering. You know, my belief is there is absolutely no need for anyone to suffer anymore. There is help out there. You just need to go find the help. If what you're doing now isn't working and this looks like it may work for you, then if we hit 10, 20, 30, 100 people that we can help, then we've done our job. So you do your job and help us pass the information on. Thank you so much for joining us today. Thank you once again, Greg, for
Well, thank you very much, Lynn. Thanks for the opportunity. I appreciate it greatly.
Oh, great. Take care, everybody. Have a great weekend. We'll talk to you soon. Goodbye for now.
Bye-bye.